So guys, today we're going to start with the next spread, which is private health insurance. And you might have heard of private health insurance before. You might, your parents might have taken out a private health insurance cover. Private health insurance is basically one of the other really important parts of our healthcare system. Even though private health, as the name suggests, it's not a part of our public healthcare system like Medicare is, but it's still a really important part of ensuring the health and well-being of Australians. Okay, so when we're talking about private health insurance, we're talking about this system or this strategy or this part of Australia's healthcare system that allows individuals or allows people to access services that are not covered by Medicare. Now, can anyone remember, maybe without looking at the answers on the slide, can anyone remember or can anyone put down in the chat box at least one example of a service or type of facility that's not covered by Medicare that you can't access using your Medicare card? Yep, physiotherapy, dental, all of those kinds of extra services. Okay, we call them ancillary. Okay, we call them ancillary services or additional services, which means that they're not included with your standard Medicare. Okay, these are not included. So, what if I'm a person who often does sprain my ankle or often does need to visit the physiotherapist, okay, for a back issue or something? How am I then going to access these services that I need? Okay, which Medicare doesn't allow me to access, but how am I going to access them? Basically, we would be able to access them using private health insurance. So with private health insurance, what we're doing is we are paying a premium, okay? And this is a cost that's paid for the actual private health insurance cover. Okay, it's different from Medicare because remember we said with Medicare kind of takes the money out of your tax and they call that a Medicare levy. Okay, they take it out of your tax, and usually when things are taken out of your tax, you don't feel like you're paying for it in some way, but it doesn't feel like you're directly taking money out of your bank account and paying it to them because it's just getting deducted as tax along with all the other taxes we pay for. With private health cover, it's a little bit different. And this is one of the reasons why many people are not really happy about taking out private health cover. Most people would love to just depend on Medicare for everything. But unfortunately, like we said, Medicare doesn't cover everything. One of the reasons why people are not happy to take out private health cover is because they've got to pay a premium. Okay. A premium is just a month by month cost that you pay for your private health cover. Just like we pay month by month for like our phone plan, just like you pay month by month in terms of bills. Premium is basically the amount of money you pay month by month for your private health insurance. Okay. And usually you do this in order to access a number of those extra services. Okay. The services that are not covered by Medicare. So that includes dental, physio, acupuncture, chiropractors, psychologists, dietitians. There's so many different services that are covered under private health cover. Now, if you go to a private health cover website, what you generally find is that you've got three types of cover that you can take out. You can take out only extras cover. So if I'm one of those people that sprain my ankle a lot or would like to do acupuncture or just have a bit of dental cover to cover any fillings or anything that I might need, I might only take out extras cover. What that means is that all of these services are covered, but let's say I want to use a private hospital, I can't do that using just the extras cover. Okay, for that reason, extras covers are pretty cheap compared to the other types of private covers. The most expensive type of cover that you can get is a combined hospital and extras cover. This is where you can actually get access to private hospitals as well as all the extra services as well. Okay, so it's a combined cover. These tend to have higher premiums, which means you're paying a higher month by month cost for that particular private health cover. Okay, so that's the basic idea. If you take private hospital cover by itself, which is actually quite uncommon, it's also pretty expensive. And most people actually opt to take out private health and private hospital and extras cover for this reason, because there's not much of a price difference between taking out only hospital cover versus the combined hospital and extras cover. Now, if you've ever if you've ever been walking in the plaza or any other local shopping center of yours, you might have noticed a lot of these different private healthcare providers. Okay. NIB, Medibank, Bupa. These are the really main ones that most of us may have seen while shopping, or you might have come across. There are so many others, so there are probably hundreds of private health insurance providers, but these are the main ones that you might have seen. Now, when you when you get a private health cover, or you take out or purchase a private health cover, for example, with me, I've got Medibank. So I actually have this kind of like red colored card that's got the name of the private health insurance provider on it, and it's basically got the date of issue. Okay, so it tells you when you first took out your private health cover, and it's got your name on it. So just like it's very similar to a Medicare card, just a plastic card. And whenever I go get my dental done, or whenever I go, if I go see the physio, which I don't, which I should, but when you use those services, you're basically showing them that card, and they're using that card almost like a credit card, and they swipe it and then it deducts money. So just like, your data gets used up, your mobile data gets used up, and you can see the amount of money you have left for the month, or amount of gigs you have left for the month decreasing, on the Medibank, it will tell you, for example, dental, if you have a yearly limit of, let's say, $500 towards dental, it will tell you that, okay, you've got, let's say, $320 left for the year. So it will deduct that every time that card gets swiped, whenever you go to the dentist, for example. Okay, so that's how private health insurance works. And you might have seen your parents actually giving this card if they've got private health cover. Remember, not everyone has private health cover, but people who do have private health cover, they can save a lot of money, especially if people are frequently going to the dentist or frequently using the physio. It is worth the money, or it is worth taking out private health cover there. Okay, so that's just a quick introduction into what private health insurance is. Now, you might be thinking, okay, well, who actually uses those private health cover services, or, are these services actually used that much? People actually do use private health services or private health cover services a lot. Okay, and as you can imagine, the most used is dental. This is the main reason why most people take out private health cover. In Australia, dental work is actually quite expensive. Okay, and to get a filling or a few fillings done might cost you up to $500, $600. Okay, if you're paying that money straight out of your pocket, and it's only for that one single time you go to the dentist, it's really not worth it. Okay, it's not financially viable for you to do that. It makes more sense for you to pay, let's say, $60 a month to get a private health extras cover that allows you to have all these extra services there, not just dental, and which also allows you to cover any fillings that you might have using your yearly limits that you have. Depending on what cover you take out, the amount of money you have for the year for dental or chiropractors or optical will be increased. Okay, so if you take out a more expensive extras cover, like a gold cover, for example, you might have, let's say, $1,000 to spend towards dental every year. Okay, so it really depends on the type of cover and the kind of level of cover you take out. So they've got gold, silver, bronze, basic. Okay, as you can imagine, the basic one is the cheapest one in most private health companies. Okay, look at the other things that are also covered here. We've got dietetics, which is related to like dietitians, optical, which is related to glasses and contact lenses, physio, which again, you can see a lot of people are using as well, podiatry, which is to do with issues with like your feet, for example, and psych, which is more mental health related services there. So you can see that people are using a range of these services that are offered by private health cover. Okay, so that's the just a basic breakdown of what types of services are most used by most people in Australia. Now, obviously, as we said before, private health cover is very expensive. So what the government needs to do is the government needs to get more people to come to private health care. Okay, a lot of people don't want to come to private healthcare, remember, because it's way too expensive. A lot of people find it difficult to make ends meet to begin with, or to pay the bills. So on top of that, can they really afford to spend upwards of $60, $70, $80? And that's for the cheapest cover that you have. That's not even for the most expensive cover that you might have. Okay, so that's the basic idea there. It's also really important to remember that, the government wants to reduce the load on private healthcare, on public healthcare. They want to reduce the load that Medicare has, because remember we said with Medicare, there are really high waiting periods and waiting times. Okay, so that can actually become an issue sometimes for people who want to get treatment done quickly. If on the other hand, you're in private health, you're under a private health cover, you might not have to wait as long to actually get the treatment done. So the government really wants to provide a little incentive or a little reward, something like almost like dangling, like, a little treat for people to come and take out private health cover, because it's not easy to persuade people to get it, to take it out. One of the ways the government does this is through a rebate scheme called the government rebate. The government rebate is basically money back. Okay. Remember, when you buy something and you get like money back from it somehow by redeeming, or they say, okay, buy this, it's worth $50. You'll get $25 back. So you're essentially only paying $25 for the item. Okay. That's what cashback is. And rebate is basically the government saying, take out the private health cover now. We'll help you to cover the premium costs by giving you cash back. So when you lodge your tax return in the middle of the year, we will basically return half of the money or half of the premium back with reference to how much you've paid. And that depends on your income. So let's say you've got a lower income and you're already finding it hard to afford most of the things, but you still take out the private health cover. The government is kind of like considerate of that, and they'll give you more money back. Okay. Obviously, if you're already like bathing in money and you're super rich, your rebate will be reduced, or you may not get any rebate at all. Okay. If you earn a very high income, the basic idea being the government knows you can afford it and knows that it's not putting a hole in your pocket to take out the private health cover. Okay. Obviously, to be eligible for the rebate, you need to be an Australian citizen or a permanent resident. And you need to also have a Medicare card. Okay, so that is what allows you to qualify for that money back or rebate scheme. That's the first incentive. Okay, and there are 3 incentives, but you just need to learn any one. So just learn the one that's probably easiest for you to remember. The next incentive that the government gives is lifetime health cover. And lifetime health cover is this basic idea that if we can get people to take out private health cover while they're still young, so before the age of 30, we can basically prevent a lot of the major kind of diseases or chronic illnesses that people develop after the age of 30. So lifetime health cover is, again, another incentive where the government basically says, if you take out private health cover before the age of 30, we will make sure that you pay less costs in terms of your premiums. But as a punishment to that, if you decide to take out private health cover after the age of 30, so let's say when you're 31 years old, you will actually pay an extra 2% loading fee. So what that means is you pay the monthly premium and you pay an extra 2% fee. And that 2% fee almost is a punishment for you not taking out private health cover before you turn 30 years old. Okay, and this is why most people actually take out private health insurance before their 30th birthday. And the government actually sends out like reminders and letters reminding people that it's good to take out private health insurance before you turn 30. Okay. And generally, some of the advantages of taking out private health insurance before you're 30 is, look, as you get older, you do start to get things like back pain. You might need to see the physio more. You start to get dental issues as well. Okay, just as a result of getting older. So you might need to see the dentist a lot more. People, especially in my age bracket, wisdom teeth are a big thing. And a lot of the time, if you're going to shell out money for that out of your own pocket without the presence of a private health cover or private health insurance, it's going to cost you a lot of money. So it's actually more worthwhile for you to take out private health cover to kind of address all these emerging health issues. Okay, so that's the basic idea there. So that's what lifetime health cover is about. You take out private health cover before the age of 30, and we'll make sure that you pay lower premiums or lower monthly costs for private health insurance for the rest of your lifetime. So that's the basic idea behind that incentive. And the last kind of incentive that we're looking at is exemption from Medicare levy surcharge. Now, we talked about Medicare levy surcharge in 10.2. We talked about it as this idea that people who earn really high incomes often have to pay 1% extra on top of the 2% Medicare levy, or even up to 2% extra. Okay, even up to 1.5% extra. So exemption from Medicare levy surcharge basically means that high or very high income earners who take out that private health cover will be exempted or excused from paying that additional 1 to 1.5% Medicare levy surcharge. Okay, they'll obviously have to pay that base 2% like everyone else, but they won't have to pay the additional surcharge. So if I'm really rich, okay, let's say I'm super, super rich, and let's say I'm earning more than $140,000 as a single person. And, you know, if I go there and if I have to normally pay an extra 1.5% on top of the 2%, if I decide to take out private health cover, what the government will say is, no, you don't have to pay this. Now you only have to pay this like everyone else. And the reason is that you shelled out the money to take out private health cover, and we like you for that. We will reward you for that. And your reward is you don't have to pay the extra surcharge now. That's what exemption means. Exemption means you're exempted from, or you're excused from doing something. In this case, you're excused from paying the extra surcharge or the additional charge if you take out the private health cover. And this is why people who are really high income earners who can afford to take out private health cover often do. Because what's the point of putting an extra 1.5% of your income in the government's pocket when you can pay a little bit extra for private health cover and get the benefits every month for yourself, the benefits of dental, the benefits of optical, okay? People would much prefer something where they are benefited, okay, rather than just giving money and not getting anything in return. So that's the basic idea. And for people who are high income earners, and as well as the government, this becomes a win-win situation. The government gets more people on private health insurance, and the person is able to avoid paying the extra 1.5% and instead invest in their health and get benefits every month as a result of that. Okay, so those are the three incentives that we look at. So in a question, if we ever ask you to describe one of the incentives, these are the three. One of the three you'll be describing. So either government rebate, which is the money back scheme, lifetime health cover, which is the importance of taking out private health before you turn 30 years old in order to pay lower premiums for the rest of your life, as well as the exemption from Medicare levy surcharge. So those are the three incentives that you're going to be looking at. Also, when you're comparing Medicare and private health insurance, it's really good to look at the advantages and the disadvantages. Advantages being that Medicare is affordable. It ensures equal access to treatment regardless of income. It also ensures and also with Medicare, it's kind of, as we said before, it's exclusive to Australians. So it's kind of like something that you can be proud of as an Australian citizen or permanent resident, that, you know, you are living in a country that gives you these extra benefits or gives you such a good public healthcare system. So those are some advantages. Some disadvantages of Medicare are long waiting lists. So sometimes you have to wait 2 years before you can go in for a surgery. You don't have a choice of doctor, as we mentioned in 10.2. You often have to pay a gap if the service is above a scheduled fee, or if the doctor doesn't bulk bill. So if the doctor doesn't bulk bill, or he says, no, we're not a bulk billing clinic, you might have to pay an extra $20, $30 out of your own pocket on top of flashing your Medicare card there. Okay, and a lot of the time, because everyone is depending on Medicare and no one wants to pay extra money for private health insurance, there's a lot of strain and a lot of pressure on the public healthcare system. Okay, some of the advantages of private healthcare, again, covers a lot of extra cover or extra healthcare services there. You can get a choice of hospital. So if you've chosen a private hospital and you're in one and you don't like that hospital, you can be transferred to another private hospital. You have a choice of doctor as well, private rooms where they're available, shorter waiting lists, and decreased demands on public services. Some disadvantages, though, are you are paying a lot of money. No one takes out private health insurance for 1 week or or 2 weeks. It's a yearly cost. So month by month, year after year, you're paying for that. Sometimes you also have to pay an excess as well. So just like a gap payment, sometimes with private health cover, you need to pay an excess, which means that you are paying extra there, okay? Which kind of undoes all the effects of you paying month by month. Another thing that we have to remember with private health insurance is that there are waiting periods. So even if you take out private health insurance in March, okay, you might have to wait until, let's say you took it out in March 2021, you might have to wait 6 months before you can be eligible to get any dental treatment done. So you might have to wait basically until September 2021 to actually, for those actual services to take effect. Okay, and that's what we call as waiting periods. And some of these waiting periods can actually prolong our health conditions and make us live with those health conditions until we're eligible to use that health service on the private health insurance cover. Okay, so that's just some advantages and disadvantages. You don't have to know all of them, just maybe know 2 advantages, 2 disadvantages for Medicare, 2 advantages, 2 disadvantages for private health cover, and that should be more than enough. Okay. Okay, don't worry about that. The questions are a bit different. Okay, so what we're going to do now, guys, is I'll just stop the recording here.